I'm Lindsay Evans.
And I'm Lauren Beck.
And we are leads for sterilization for GMOM 2013.
First, we'd like to talk about all volunteers in the sterilization department must be current on their hepatitis B vaccination. Also, you're required to wear personal protective equipment, which includes eyewear, gloves, and a gown. If you would like to bring your own, we encourage you to do so. We also want to talk about how the sterilization department is set up. It's going to be a mirror image of each other. One side will be mom instruments and one side will be personal instruments.
For sterilization and cleaning of instruments, we will wash off all gross debris. We will use an ultrasonic, put instruments in pouches or wrap them. We will also use the autoclave, and then we will distribute the instruments either back to the doctor who brought the instruments if they brought their own, or we will put them in the mom tubs, which are identified with photos. Everything will be separated. That way it's easy for the patient, for the next patient, so that the assistant can get what they need when they need it. We are limited on instruments, so we got to make sure that we take care of all of the instruments, put them in pouches, put them in the tubs accordingly, so that it's easy and accessible for all of the assistants to get. We also want to emphasize that for personal instruments, that everything is labeled by the assistant. When they bring the dirty instruments up, make sure they put the doctor's name on the pouch, and the pouch stays with the dirty instruments until that instrument is ultrasonicked, and then it will be pouched and autoclaved and ready for pickup. We'll try and do it within an hour, but they'll have to understand that it can take longer. It just depends on how the day is going in sterilization. Also, we want to emphasize about sharps. There are not to be any sharps to be brought to the sterilization area except for burrs, and those are to be out of the handpiece. We will have paper boats for the instruments to be put in when they pick them up, and also for when they bring them back to us for sterilization, and the burrs can just be in the bottom of that boat. So we must be very careful as to not get stuck by the burrs. As far as needles, they should be disposed of at the unit and not brought to the sterilization area. If we do have any sharps that are brought to the sterilization area, we will dispose of them so they're not going back across the clinic floor, but we need to emphasize that that's not to happen next time. To keep them away from us as much as possible, since we won't know where the patient has been or where to go back if there was a needle stick. We will do the best we can as far as needle stick protocol in the sterilization area, but we must be very careful to prevent that. If you are stuck or punctured with an instrument or a burr or a needle, if it comes in our area, notify Lauren and I as soon as it happens. We will do the best we can as far as tracking down that patient to make sure everything's okay. If we need to get anything checked, we will definitely do that. But just make sure that if anything happens, to notify us as soon as possible.
Also, if there are any broken instruments, please set those aside and we'll deal with those. Also, we would like you to stagger your breaks so we can keep the flow going. Please remember that the patients are our guests today. We want you to treat them with utmost respect and your fellow sterilization volunteers.
We want to encourage you to be flexible. Sterilization is a long and hard job for us. We will have fun. We will wear zebra hats.
And we want you to wear comfortable shoes. It's
Yes.
going to be a long day, a good day, but a long day.
We will make it as fun as possible.
We want to also thank you for volunteering.
We look forward to seeing you at GMOM 2013.